Train these students in school. Yeah, because imagine if a school that is paying 40,000, let's say for example in other schools, they are paying 40,000 as fees, and then they are crying. What of the school that is not paying fees?
Kama hatutapata chakula, kama wanafunzi watapata chakula, watakuwa na shida na shule wanaweza funga shule.
They are now calling on the government and other stakeholders to step up efforts and support pupils and students in conflict-affected areas. Timothy Kipnusu for Prime Edition.
Kalaazar, also known as Visceral Leishmaniasis, has proved to be one of the most tropical diseases in the arid parts of West Pokot, affecting hundreds of young learners silently without being noticed. The disease, caused by a Protozoa parasite of sandfly species, has seen a majority of pastoralists' children affected. As a result, several groups are now calling for an increased advocacy and mobilization to ensure that the education and health of the children is not compromised.
In the arid regions of West Pokot, hundreds of young learners are silently battling a formidable enemy, Kalaazar, also known as Visceral Leishmaniasis. This neglected tropical disease is taking a heavy toll on the health and education of children, particularly in pastoralist communities. According to a report by the Kalaazar Treatment and Research Center, 70% of its Kalaazar patients are children under the age of 15.
Majority of our clients whom we see in this facility or in our facilities are children under 15 years. And this is impacting negatively in terms of their education because of the time these children are in the hospital. Averagely, every child will miss like a whole term.
The disease, characterized by prolonged fever, weight loss and enlarged spleen and liver, mimics malaria, leading to frequent misdiagnosis and delayed treatment.
People who live in the very areas, where they cannot go to the hospital to seek for the medication, they thought that this disease is malaria. By the time they are here, maybe the child is very sick and is anemic.
Parents like George Lokeris have experienced the harrowing journey of seeking treatment for their sick children. Lokeris shares that his son, Henry Kisang, had to drop out of school for nearly a year before being correctly diagnosed at the Kacheliba Center.
Alikuwa anaanza wiki moja, mwili yake nayo inakuwa joto, inakaa nyumbani tena. Tunaenda hospitali tunapatia mapanadol. Baada hapo hivi, baada wiki mbili hivi tena inaanza hivyo. Ikasumbua hivyo mpaka akakosa hata kufanya mtihani. Yeye hata kuelewa vitu kwa darasa haileti. Ndio sasa baadaye akapata improvement wakati alipata dawa.
Despite these challenges, organizations like the Drugs for Neglected Disease Initiative are working to improve treatment accessibility for rural and remote communities. However, the impact of Kalaazar on West Pokot's children calls for increased advocacy and mobilization to secure their education and health.
Mtoto akigonjeka na umetibu malaria na kama hajapona, tafadhali harakisha kimbisha Kacheliba.
Advocacy is the way to go. The community need to get information of early seeking behavior of the services, of the health services at the nearby facility, so that they can be referred for Kalaazar services. That's a testing.
Kalaazar, caused by a protozoan parasite transmitted by sandflies, is fatal if left untreated in over 95% of its cases.
Farmers from Muiru Coffee Society in Tharaka Nithi County are tonight going to bed in shock after they woke up to find empty stores with 121 bags of coffee missing. The irate farmers say that the stolen bags are estimated at a cost of 3.5 million shillings, pleading